Thank you. So actually, came back from Japan last year, joined the UHCC. I had been trained in medicine in Hawaii and get trained in my fellowship in Florida, returned to my country in Japan. So I'm going to touch on the current state of cancer care in Hawaii to use next 10, 15 minutes. So if you ask, have you been to the States, back in Japan, everybody think about the continental America, like in New York City, San Francisco, and in Chicago. But here in Hawaii, in the 50th state of the country, we are America also. But, I'm sorry. So we are located in the middle of the ocean, 24 miles away from San Francisco. But we are the healthcare taking care of the far west to the Guam, 4,000 miles away. In this radius, so a lot of islands here. I'm sorry. You can see American Samoa, Commonwealth of Northern Mariana Islands, Micronesia, Guam, as I said, Republic of Marshall Islands, and Palau. So this area holds almost 2 million people. And then we observe almost 8,000, more than 8,000 newly diagnosed cancer patients in this area. So we are responsible for taking care of these patients every year. Well, we are in a unique population diversity here. If you introduce you to a person sitting next to you, you can find how we are in the diverse society, community here. But there's no actually dominant, ethical, racial group in this state. Almost 20% of each divided into our population. 20% Asian, 20% European ancestry, and a little bit more than 20% Native Hawaiians. And then other 20% is a 2 or more race or ethnicity group. So that's how we are in the diversity the community we are currently living. So our catchment area represents this unique population. And for cancer care and research, due to several factors you can see here. So our geographic location results in limited access to specialized in cancer care and in clinical trials, which emphasize the importance of our cancer center activities. We face significant poverty challenges from historical injustice, high cost of living, and economic dependencies, such as Hawaii is over reliance of tourism, and some Pacific nations dependence on foreign aid. The high cost of housing in Hawaii has contributed to notable homelessness. At the same time, many Pacific islands grapple with direct threats of climate change, limited natural resources, and brain drain as a citizen seek opportunity abroad. So among our different populations, some ethnic groups, Native Hawaiians, Pacific Islanders, Filipino, Southeast Asians, experience higher incidence, prevalence, or mortality of many cancers: breast, colorectal, lung, liver, endometrial, pancreas, gastric, and thyroid cancers. Hawaii population is unique. As I said, we don't have any the dominant racial ethnic groups at all. But also, Hawaii is an aging society too. It's almost 20% of residents are 65 and older. And this reflects a 45 increase in the 65 older demographic compared to 2010. The aging population reflects increased cancer risk and presents the opportunity for cancer center to mediate better care. We have distinct characteristics can influence cancer care and research. These factors include climate, diet, exposure to environmental carcinogen, and geological phenomena such as volcanoes. Access to healthcare. These factors drive us to study all kind of unique cancers: hepatobiliary cancer, mesothelioma, melanoma, and aggressive type of breast cancer and lung cancer. Hawaii and the Pacific have a rich history of traditional medicine too, and wealth of environmental biodiversity. Many collected endemic organisms comprise a natural products library, which can be leveraged to identify new therapeutics to prevent and treat cancer. So we prioritize 4 focuses in our cancer care here: health disparities, common cancers, community needs, and resource availability. Overall, cancer-related mortality is the highest among the Native Hawaiian compared to the other ethnic racial groups. We recognize the significant disparities in cancer incidence and mortality among racial and ethnic groups. To address this, Cancer Center research programs prioritize addressing ethnic disparity needs and focus on specific cancers that disproportionately affect these populations. The population science and cancer biology programs at our center specifically address our catchment area population's unique environmental, social, and cultural characteristics. The Community Outreach and Engagement Office works alongside each research program to ensure that our research remains relevant to the needs of our catchment area, to provide public education and prevention, and to promote clinical trial accrual. So Native Hawaiian women, breast cancer incidence and mortality are notably higher compared to other racial and ethnic groups. In prostate cancer, Native Hawaiian men exhibited the lowest incidence, but the highest mortality rate for prostate cancer. Lung cancer incidence, highest among both Native Hawaiian men and women. Notably, lung cancer mortality is particularly high in Native Hawaiian women compared to other groups. These research efforts include examining cancer with high incidence rates such as liver, which is the second most common in Hawaii. And then thoracic cancer, lung cancer is the leading cause of cancer death in Hawaii. And aggressive breast cancer compared to the other ethnic groups. So we also have a strong interest in studying environmental factors unique to our community, contributing to the increased incidence and mortality of specific cancers, like mesothelioma, due to the local presence of a large U.S. Navy shipyard that heavily used asbestos. And also, we enjoy sunshine in the ocean, but that causes more melanoma compared to the continental states. So due to the limited resource in a catchment area, limited access to healthcare, We focus heavily on cancer prevention and screening measures to catch cancers at earlier stages and reduce the number of cases leading to the need for treatment. In the U.S. affiliated Pacific Islands, the screening rate is very low due to many areas not having machines, technologies to screen for cancer. The use of more preventive and screening measures can help to reduce the incidence of preventable cancers such as breast, colorectal, and lung. So in 2010, the UH Cancer Center led a powerful alliance between local healthcare systems. This collaboration, known as Hawai'i Cancer Consortium, included 3 of the 5 major private healthcare systems within the state: the Queens Health System, Hawaii Pacific Health, and the Kuakini Health System, and Jobson. U.S. Cancer Director Dr. Ueno serves as the president of HCC. The major private health insurer in the state, HMSA, also formally joined the HCC in 2019. In 2020, the Hawai'i Cancer Consortium expanded again the addition of Adventist Health Castle, which serves as a large Native Hawaiian population on the east side of Oahu. We have a long-standing affiliation with the Triple Army Medical Center through joint research project, grants, and clinical trials. The private practice of Hawaii Cancer Care participate in UH Cancer Center managed clinical trials as well. The UH Cancer Center plays a significant role in engaging the community and relying heavily on this network to administer clinical trials effectively and provide exemplary cancer care. So this network covers 2/3 of cancer patients in Hawaii. So UH Cancer Center and Hawaii Cancer Consortium launched Ka'umeke Lama Clinical Oncology a program, which has 3 pillars, as you can see. One is focused on clinical activity, clinical trial platform. We have each disease site working group with a mixture of community doctors and our academic doctors and APP, forming a clinical trial network. And then secondly, clinical education. This is a part of clinical education activity. We'll do a quarterly education activity collaboration with Hawaiian Society of Clinical Oncology. And in this ASCO Direct, this is the first time we organize hosting ASCO Direct, but hopefully we can continue this program annually later on, and eventually include international Pacific Rim countries to make a really intriguing conferences for internationally as well. And outreach into the neighbor islands and US API to solve the health disparity issues. We've been working on these 3 pillars under the program Ka'umeke Lama. I want you to remember the name. So these 3 pillars we've been working on. Because to obtain the goal, we want to be a beacon of hope. Let's work together with you so that we can be a beacon of hope for patients and families suffering from cancer. No matter where you live in Hawaii, all residents deserve comprehensive cancer care without leaving the islands. Let's save the lives of as many cancer patients as possible on our islands. Let's put our hearts, bodies, and wisdom into it. Yes, we can. I look forward to walking this journey together with you all. Thank you. So I'd like to invite next speaker, Dr. Jared Akova from Hawaii Oncology, associate researcher at USCC, to present on colorectal cancer. Please join me. Welcome to the stage.